Good afternoon, and welcome to Breaking Down Biomedical Device Security, a Health System CIO production sponsored by Zingbox. Just a little housekeeping before we get started. My name is Anthony Guerra. I am going to be your moderator today. I'm the editor-in-chief of Health System CIO. We're going to have some fun interactive features today during our event. First, we've got our agree or over-the-top poll, where we put out some statements and get your opinion on them and hear from our panel as well on them. Questions and comments, we want you to send those in as they occur to you. Leave the default set to all panelists and send them in the Q&A box, and we will definitely look at those, so we encourage you to send those in. And you can download the deck by using the URL on your screen, and it's actually, it's being sent out in the chat box, and it's the bottom of the slides. So you'll be able to use that. So you can see how we're going to spend our time today. We've got Will Long, VP and CISO at Children's Medical Center, Theresa Meadows, SVP and CIO at Cook Children's Healthcare System, and Mayuresh Ektare, VP of Product Management with Zingbox. We're going to go about 35, 40 minutes with our main panel discussion, and then we will have our Q&A. So without further delay, let's jump right into the conversation. Will, let's start with you. You want to give me an overview of your organization and your role?
Good afternoon, everyone. This is Will Long with Children's Health. My role is over all of the cybersecurity functions for Children's. We have a team that manages everything from threats on biomedical equipment, all of our networks and systems, manages our identity and access management, risk management, and the engineering and security operations center. And that team is responsible for what we'll be talking about today, the risk management that surrounds biomedical device security, and we are very integrated with that team that manages all of the security threats in that space. Thank you.
All right, very good, Will. Thank you. Theresa?
Hi, good morning. Theresa Meadows. I'm the Chief Information Officer at Cook Children's Healthcare System in Fort Worth. In my role, I oversee all of the information technology for all of Cook Children's, which includes security. Our Chief Information Security Officer actually reports to me, and through his leadership, he manages the biomed devices, and biomed security is just one of the many things that, our CISOs do on a regular basis. Probably the main reason that I'm on this call is I've spent a lot of time over the last several years working in cybersecurity, particularly with some of the federal initiatives with the Cybersecurity Task Force. So I really look forward to talking to everyone today. Biomed security was one of our top initiatives that we really wanted to see addressed through the task force and its ongoing work.
Very good. Mayuresh?
Good morning, everyone. This is Mayuresh Ektare. I lead the product management team at Zingbox. A little bit of background on Zingbox. We have been a 4.5-year-old company now, essentially created a market for security for including the medical devices. And I've been part of this organization ever since we were founded. Look forward to the conversation today.
All right, very good. Thank you for that. Okay, first question, let's jump right in. Theresa, if you want to take a crack. What special challenges do biomedical devices present to an IT security team?
Yeah, that's a great question. I think there are lots of challenges, and it has to do a lot with, first of all, just understanding all of the biomedical devices that you actually have in your environment and what level of risk do those devices actually present to your team. If you haven't done a good assessment of that, sometimes it becomes daunting because the number of medical devices that we continue to have in our organizations grows on a daily basis. Not only the devices that are, in direct patient care, but also the Internet of Things devices that may be refrigerators that are on wireless or some other type of device that's out there. And I think part of the challenge that we have is that we have to work closely with device manufacturers on ensuring that the security capabilities are there in the devices that we purchase. And I think, unfortunately, historically over the last, 20 to 30 years in healthcare, there hasn't been a lot of focus on making sure these devices are secure because they were never really connected to anything until the advent of meaningful use and, interoperability and the needs there that we have for patient care. And so I think, those security needs escalated sort of exponentially because we weren't really thinking about that as we were going through implementing our EMRs and the things that we've been doing over the last 10 years. And so I think for most of healthcare, we're now to a point where we need to focus on the biomedical devices, where we spent a lot of time focusing in other areas of security over the last 5 years or so.
Very good. Thanks, Theresa. Mayuresh?
Sure. Biomedical devices, I would group them into the same Internet of Things bucket, actually. These devices, there are three major challenges around visibility. Building out a comprehensive inventory of what kind of devices even are on the network is the first challenge for many of our customers. The second aspect to that is security of these devices. Many of these devices, biomedical devices, do not support installing and to secure those assets. In such a scenario, how do you really protect these devices, through the network? And finally, the last but not the least is actually management and ongoing management, vulnerability patching on these assets. These are the three key areas which really highlight biomedical devices require a different way of security for them. The fact that they have a long shelf life, they have very limited support sometimes from the vendor. These devices could be running a very old version of operating system, really requires a different approach towards managing, monitoring, and securing these devices. Just as a statistic right now, we have been monitoring over 11 million IoT devices, and our recent stats from threat report that Zingbox publishes are very interesting. For imaging systems, about 27% systems in 2019 were running an outdated operating system, and that number is going to grow to 85% in 2020. Imagine 85% of the imaging systems are going to be outdated in next year. What kind of security policies and procedures would have to be for vulnerable assets? Because just because they're running an outdated operating system doesn't mean that we are going to replace those devices anytime soon. Many of our customers have spent like millions of dollars in acquiring these assets. That is why a completely new approach to securing these devices.
Okay, very good. Will?
Thank you. Yeah, it was mentioned earlier, I think Theresa pointed out, knowing what you have, the inventory of those devices is key. And I would say on after inventory, the next key is understanding the risk profile of those devices. And by risk profile, I mean categorizing those into what kinds, understanding the use of those devices, whether that device could cause patient harm if it malfunctions. Does it contain lots of personal information? Does it contain PHI? How much does it contain? Is it encrypted? All of those kind of categories that make up the risk profile will help you prioritize the risk. Another challenge we have, shelf life was mentioned. Not only that, the time that it takes for the manufacturers to develop and build these, they sometimes often deploy stuff on an operating system that's already half or 3/4 way through its useful life by the time it hits the market. And then those things live for many, many years. And so I agree that they are very much like IoT devices. And you have to wrap a complete security stack around them. Infusion pumps and other things don't allow you to install antivirus on them and so forth. And so you have to have a whole other approach, because patching them when you have thousands of devices, all kinds of different embedded operating systems, being able to patch those is incredibly difficult. And one of the challenges with patching them is just the operational downtime for the organization in a healthcare setting. Taking these systems down that are in trauma rooms and ORs and so forth getting that kind of time throughout a healthcare system to patch them is very, very challenging. So while patching is important, it usually cannot be done in a fast enough that most organizations want. So that particular challenge means you really have to wrap a complete security system around those devices to help mitigate the security challenges that are inherent with maybe patching that's not as easy to do as it would be on a desktop PC.
Very good, Will. Thank you for that. All right, next question. Which other departments and personnel must the IT team work with to secure biomedical devices? Theresa?
Yeah, this is actually a team sport, so there are lots of departments that we work with within IT. So your security team, your networking team, your infrastructure team. There may be an applications team associated with that particular medical device. So it really takes all of those teams within IT really focused and working together to find the best method to secure the device. And then you also, depending on how you're structured, your biomedical equipment team is very important to have them at the table and part of the discussion and what's the best way to move forward on that. And then I think the third thing is really who are your external resources. When you start working with groups like the FDA or the device manufacturer themselves, having them at the table is really important as you work through how do you secure these devices.
Very good, Will.
Theresa mentioned several of them. I would say a lot of the technical teams that it requires to wrap that security stack around those devices that I mentioned earlier. So we have found that those networking teams are one of the most important. A lot of the segmentation activities and keeping these and applying IoT type strategies to securing them, such as segmentation and networks, using technologies and tools to detect anomalies of these devices. One of the advantages that we have is with biomedical devices is they act the same way all the time. And when they don't, you can detect that you might have a problem. So because they operate that way, the networking tools we have found and the technologies that we deploy, that one department, while there's many departments involved in it, we spend probably the most time around all of the technologies that are deployed to get visibility, detect anomalies, to keep the segmentation of the devices appropriate. That's probably where we spend most of our time.
Okay, very good. Let's talk about the dangers that legacy biomedical devices present. Mayuresh?
Certainly. Will brought up a really good point. The legacy biomedical devices and any other medical device out there can be summarized in two parts. The first one is how do you really proactively secure these assets, and what is the reactive strategy towards protecting should an incident happen on these devices. So from a proactive, it is really essential, first of all, to build out that inventory, understanding what is on the network, understanding its risk profile, and then grouping these assets in context-aware microsegments. Today the network is really smart. If you and I bring in a cell phone or a laptop to the network knows and puts it in the right VLAN, applies the right kind of policies to it. But the network today is really not smart enough. When a medical device is brought onto it, if an infusion pump is brought onto it, it has to be manually provisioned, it has to be manually secured. A complete orchestration solution that can apply the right policies, provide a zero trust framework for these devices. As Will was pointing out earlier, these devices exhibit a predictable behavior on the network. Whether it is a legacy device or a modern a medical device, they are designed to perform few things on a very repeated, translating their behaviors into zero trust policies and only allowing these devices to exhibit those trusted behaviors is the proactive approach we can all take towards securing these medical devices, whether legacy or new. Now, after taking all of these best practice measures, should something does happen to these devices, that's when the reactive approach kicks in, wherein we really have to work with multiple different departments, groups within the organization, whether they be network teams, the security teams, the SOC teams, or the biomedical teams who have feet on the ground to actually touch these devices. The comprehensive remediation workflow. We have seen best practices where network solutions have a direct integration with clinical work orders, allowing the clinical technicians to very quickly respond to threats on medical devices.
All right, very good. Will, you had mentioned this before about these devices. We know how they're supposed to behave, and that can really help in terms of figuring out when something's going wrong. So your comments on either what Mayuresh said or the question in general?
Yeah, I think investing in networking technologies that he mentioned and detection systems help greatly in detecting those anomalies. Another technology to consider is, I call it setting up traps. You can also use, they're sometimes called deception devices. There's a number of technologies now available to mimic those devices, and if they're touched or they're by a bad actor or some virus or worm, something on your network, those can be deployed on those segments to help in that anomaly detection, basically setting up fake devices that are actually traps for the bad actors. And so that can be used on those networks where you might have lots of legacy devices that you can't patch up like you would want to or secure like you would a traditional endpoint. And those have proven to also be great ways to catch those anomalies and those behaviors.
Very good. Theresa?
Yeah, the only thing that I would add about legacy devices is I think the problem is really global. The challenge we have is that most of our medical devices were purchased before cyber was a huge issue, and most of the time was spent on HIPAA-related concerns. And for the device manufacturers, when those legacy devices were built, they didn't provide a mechanism for updates, and so it puts healthcare organizations in a strange position because if you have a 10-year-old plus device, there really isn't a mechanism to improve that device unless we purchase new devices. And I think that's going to be the historical problem that people are going to have for many years, is that new medical devices are going to come out with the appropriate abilities to patch and provide, security updates. But it's all the legacy things that we're going to have to figure out how to either remove them from our environment or segregate them on our environment, or determine how we're going to deal with those things. And this is not a 1-year problem. This is a 10 to 15-year problem for most organizations because the funding is just not there to replace all these legacy devices. So I think it's really important as an industry that we get creative about how we are going to manage these devices until they can eventually be replaced. And most organizations are dealing with this issue just because of the lack of funding that organizations have to replace for example, a whole fleet of IV pumps if they're 10 years old and they don't have the most accurate security. So I think, this issue is going to be something that is going to plague us for quite a while, and finding creative solutions is where we need to go to next with those legacy devices.
Right. Very good. All right. Theresa, let's stick with you. What are some best practices in equipment procurement or policy that help ensure the right devices are acquired and deployed? So we get away from the fact that this device is a problem because we can't patch it, we can't update it. As we're purchasing things now, what can you do to make sure that devices like that don't come onto the system? Are the manufacturers doing better now with the type of thing they're putting out there?
Yeah, and to your question about are the manufacturers better, I would say yes and no. I think if you're a large manufacturer, Philips, GE, you are doing better. I think our challenge is some of the smaller niche vendors And that's where a good security risk assessment comes in. And so in our organization, we actually have a biotechnology team who works and does security risk assessments on all net new pieces of medical technology that we'd want to bring into the organization. We've actually kind of created a process where the organization can't purchase a piece of equipment without it going through that security process, or at least review. It does not mean we won't buy it. So there are instances where, we might have a really unique service that we want to offer to our patients. And a great example for us is we have a gait lab. There are only two biomedical equipment vendors who make a gait lab, which is a piece of technology that assesses how children walk and how do we improve the walking and their activities on a daily basis. Neither one of those pieces of technology at the time when we purchased it had the appropriate security profile that we would have ideally liked. And so that's where some of the things that Will, recommended about putting some walls around these pieces of technology, because you're never going to 100% get away from buying something that isn't 100% secure. I think we're far away from that, but over the next several years that will improve. And then I think the second thing that we're always going to encounter is, the rogue device that comes in. Somebody comes in and wants to demo a device, and it ends up on our network. And that's where the monitoring comes in, and knowing when those things show up, because then you can maybe not be as proactive as you'd like to be, but at least it won't be on your network for 3 weeks, and nobody knows that it's there.
Will, any thoughts on procurement?
Yeah, sure. One of the best practices is to make sure, Theresa was mentioning it, you really have to have your finger on all of the ways devices might enter your healthcare system. That could be through demos, through research and grants, and normal procurement of operational things, through your capital processes, all of those pathways where a device might come in. If you have you're well plugged into that, you're connected to those systems, you know what purchases are happening, then you get a chance to review that stuff and help the organization know what the risks are going to be. That's what our job in our risk management, risk assurance team is, not to say necessarily no, it's to say, here's what the risks are with that device. How are you going to, these two risks might not meet the policy. How are we going to mitigate those? And working through that to mitigate risk, just like you would with an application or a cloud vendor or anything else. And working through that, it really takes being correctly plugged in to all of those methods that devices might come into your system. And then having the monitoring in place, like Theresa mentioned, to detect when something comes in as a demo or something, and something gets plugged in, you've got to immediately know about that so that you can work to mitigate any risk that it might present.
Very good. Okay, next question. Having knowledge of what is on your inventory seems like a great place to start when developing a program for better device hygiene, which we discussed about. We talked about that. Can you talk about how it may lead to better security? Mayuresh, your thoughts on knowing what's on the network, and we talked about trying to make sure from a procurement point of view that you're plugged in everything. That's not 100%, right? Some stuff's going to get in there, especially the larger the system we're talking about. Something's going to sneak in. Somebody's not going to follow protocol. So you need the tools to know when something comes on that hasn't been sort of brought through proper channels. So your thoughts about that?
Certainly. One thing I would mention about procurement, apart from the great points that were mentioned earlier, is budgeting for security. Today the models are in place where when we buy IT equipment, whether it is a laptop or a server, we do budget for going to secure that asset. No one today buys a laptop without thinking about the antivirus solution. The same models need to be applied to IoT devices and medical devices going forward. Having said that, the inventory really becomes a critical component, because understanding the attacker to understand what type of devices are really on the network and the risk footprint of each one of them. There are multiple ways devices might get onto the network. whether they are procured or demo or even rental equipment. We have seen numerous times medical devices are rented on a monthly kind of risk exposure would an organization have because of such rental equipments. The fact that we currently lack a single framework that allows anyone to manage, monitor, and secure these diverse set of medical devices through a single pane of glass is the most challenging aspect of it. And getting that centralized inventory is just the first step towards understanding the attack surface so that you can actually plug the holes and really build upon your security programs.
Very good, very good. All right, let's go to the next question. Will, let's go with you on this. What does your network topology look like? Do you have different VLANs for different types of devices? Are these separated from your networks? How do you think this segmentation affects your security posture?
Yeah, I mentioned segmentation earlier. I think segmentation is one of the key things in building your network. Sometimes organizations have a hard time retrofitting. Their networks might not have been built that way, just like these devices we're talking about weren't built with security in mind first and prior to all the cyber threats being as prevalent. The networks in systems sometimes are not segmented well, and that has to be kind of retrofitted. Sometimes that requires capital investments and changes in the networking equipment. But getting that done and putting in segmentation, just like we would do with any type of IoT equipment, greatly helps you reduce your risk and things spreading and allowing you to control that traffic. Because those devices act the same way all the time, they should only talk to certain servers and certain applications and certain interfaces, and they shouldn't talk to anything else. So putting those on separate segments is one of the key strategies of reducing risk with biomedical devices.
Theresa, any thoughts on that?
Yeah, I don't know if I'd add much more to what Will said, but I do think today the industry as a whole, that's how we're approaching it, is really trying to segment as much as possible and, redesigning our networks to be able to accommodate that until we can get better devices, deployed into our environments. And really, it takes a lot of network redesign, and I think many organizations are going through that now. Just what is the best way to redesign the network to facilitate adding devices, whether they're for direct patient care and need to connect to the EMR, or are they things that we can totally segment away from all of patient care? And so I think it takes a lot of design work and that's where organizations probably need to start until the devices catch up. And so I think that's where people are spending most of their time today.
Very good. Mayuresh, anything you want to add?
I'll just add, it was rightly mentioned that network redesigns are really, it's a heavy lifting to be done, right? Which requires a complete architectural redesign of the network. As you start thinking about the security posture and the attack surface on these assets, it's one of the critical components is visibility, and visibility in the form of situation, understanding. If you have your infusion pumps on certain VLANs that also have certain other types of equipment, allows you to really understand what might be the attack vectors that might affect your medical devices, and getting that situational awareness really informs you where your strategies for micro-segmentation might be best targeted. You may not want to segment the entire network, but just might want to start off with the most critical medical devices.
All right, very good. Next question. Theresa, let's go with you on this. What industry resources exist to help IT security professionals stay abreast of the latest threats? What are the latest federal policy and programs in this area?
Sure. I think that, the industry has really come a long way in the last, 3 to 5 years as far as resources. I think the challenge that we've had is we haven't communicated them well. So there are a lot of great industry resources that people can take advantage of, such as some of the health information security sharing organizations. There's a national one for healthcare that people can join at a very low cost that will provide you information on a fairly regular basis about what are they seeing as far as threats, what are people doing to mitigate those threats. They do webinars and they educate folks on, what's the best security posture based on your size of organization. There's also been a lot of work through the Healthcare Sector Coordinating Council, and there's been some really good work that's available, free resources that really help security posture in hospitals by telling them, giving them a list of things that they can focus on and work towards. You've probably heard of the Healthcare Security Best Practices document, which lists, if you're going to look at your security environment, here's how are the things that maybe you should focus on first, second, third, and fourth, and how do you assess your environment to make that the best use of your time or resources or money. And I think those are really great resources. They were developed by the industry, so people who actually work in security and healthcare every day, along with our governmental counterparts. And then the last thing I would say is there's always policy work going on, and cybersecurity crops up in the strangest places as far as policy work is concerned. So there recently have been several requests for information from the federal government. One was around, modification of the Stark Law. Most people would not consider that a cybersecurity issue. Stark limits, the donations that hospitals can make to other providers because of the fear of inducement for referrals. And so one of the things that the Cybersecurity Task Force looked at is if we could include security resources or security software as an exclusion to Stark, that would help the industry as a whole, because there are a lot of smaller organizations who can't afford security tools or can't afford to redesign their network. But as a larger organization, if I were able to help them out, it helps them and it helps me since we're connected together. And so I think there's always an underlying security component in a lot of the federal policies that are being reevaluated over the next, probably couple years by the government. And so I would recommend certainly, getting engaged and looking at how security can be embedded into some of these policies when it wasn't really considered in the past.
Very good. Will, anything you want to add?
Well, Theresa covered good coverage of all the national and federal type things. We track other things too, such as information sharing groups and national vulnerability databases. We use threat feed companies and organizations to keep us up to date on threats to these devices and others. Some of these devices are, we get really good information from the manufacturers. We're seeing a big improvement in their disclosures and keeping up with the latest threats to these devices, in addition to other national and federal resources that allow us, such as CERT, to monitor emerging threats or new threats so that we can react in a timely manner.
Very good. Mayuresh, any resources that weren't mentioned that you follow or recommend?
Certainly. We also leverage HISAC for sure. Many vendors like Zingbox also send threat information to HISAC so that it can be appropriately distributed across the healthcare industry. Apart from that, vendors like Zingbox also have early warning systems. So should similar devices be impacted or compromised at certain facilities, warning system that actually notifies other customers to take precautionary measures with best practice recommendations to secure their assets proactively. These are the platforms that healthcare systems should start taking advantage of, because devices are very unique, unlike what we see as a common practice on the IT side. Protecting these devices really requires a different way of thinking in terms of how do you create a transparent shield around a most vulnerable asset without actually touching that device?
Very good. Okay. Next question. Let me get to the one I'm looking for. All right. Mayuresh, I'd like to start with you on this. And we've talked about this. It's a big issue with the manufacturers of these devices. And whether or not they're certainly contributing to the issue, if they're not, the sole creator of this issue, if they're not doing what can or should be done to deal with these older devices, they're not sort of stepping up and taking the hit for putting things out there that are no longer, safe and secure. So how best can hospitals and manufacturers work together on this issue? Any advice there?
Sure. While this is a shared problem and everyone needs to take responsibility towards securing these assets, the procurement, which is the manufacturers, can definitely step up their game towards security around these assets. However, it would be unfair characterization to completely pass this issue down to the manufacturers, right? Take the same example from our IT infrastructure today. While Microsoft provide regular security updates, organizations oftentimes deploy tens and dozens of security solutions to protect that infrastructure. I think a similar approach really has to be taken from a responsibility perspective on both sides, hospitals as well as manufacturers, right? Where hospital systems also realize the fact that while these devices would be supported by the manufacturer to a certain degree, there is also a shared responsibility in terms of the environmental factors that might be affecting those devices. We look at medical devices from two perspectives: the intrinsic security on that device and the environmental factors that might affect that device when placed in a certain network. How do you protect the device from both of these angles, right? Inside out and outside in need to be taken into.
Very good. Will, your thoughts around the manufacturer's role in all this and what sort of healthcare IT professionals at hospitals and health systems can do in their relationship with these manufacturers to get this problem closer to being solved?
I think of a couple things. First, working with the manufacturers to have those vendors and manufacturers provide guidance around how to secure those devices better, more disclosure around the software that is and the components that are used to build those devices. One of the challenges that we have in the industry is most of these devices, especially the legacy ones, do not come with a good inventory of all the software components that are used to build them. Therefore, it's a little hard to patch and manage those devices when you don't know what's kind of under the covers, if you will. Behind those devices might be the software and the core components they're built on. So I think we call that the software bill of materials, and we have been working hard with large manufacturers and industry groups to get full disclosure from the manufacturers on what are the components in these devices and how better to secure them. And beyond that, another thing we've been working on nationally and with groups is really pressing the manufacturers to build devices that are secure and have good cyber hygiene from the beginning. And on top of that, I'm really looking forward to a day where those devices are built with this a simple security stack that doesn't allow any software or scripts or anything to run on those devices that was not deployed at the time it was manufactured. And similar to, you could think of maybe a whitelisting technology would be something similar. But if we would have devices that were delivered to us that had good cyber hygiene and not look like an IoT device and have generic passwords or hard-coded passwords and all of those basics, if all those basics were right, and that device had a built-in technology, it doesn't have to have an antivirus. It doesn't have to have all of those advanced threat software stack installed. It simply has to have a whitelisting type technology that won't allow anything to run on that device that wasn't delivered. And so we've been working with some large manufacturers pressing that initiative forward so that those devices could be delivered and manufactured and could run and be in much more secure posture without us having to load security stacks on those devices. Remember, some of those devices are small. They don't come with large hard drives. They don't come with things that you can load security stacks on. But technology could be built into those devices to prevent things from running on them from the start. And so we're actually seeing some manufacturers move in that direction, and that's promising.
Very good. Theresa, any thoughts on that?
Yeah, probably the only other thing that I would add to Will's comments is, it's really a three-legged stool. There's a manufacturer, there's us, and then there's the FDA. And I do think having more stringent guidelines in the process of, producing new devices, there will have to be some regulatory, oversight of those manufacturers to ensure that they deliver. And so I think just those three things together are very important as we move forward. And we've seen great support from the FDA in moving in that direction to ensure that new devices have a lot of the features that Will was suggesting going forward. And then the last thing I will add is I think we have to work very closely with the device manufacturers on how do we remove the legacy devices from our environment, or how do we secure them better without the answer always being you must buy all new equipment.
Mm-hmm.
And so whether it's a rebate process or some kind of, devices for clunkers or cash for clunkers or some other mechanism, we have to find a way to move those things along faster. But it can't be just always you have to buy something. And so I think those are the things that we need to work through.
Yeah, that's a great solution for the manufacturers, right? But maybe not for everybody else.
Yes, right.
So, all right, we're going to go with our agree or over the top feature. So I'm going to open that poll right now. So if you'll see the three statements in front of you, and we want you to answer whether you agree with the statement or you think it's over the top and not fair, as it were. So let's go with the first one. We're going to get reaction from our panelists. And everybody, if you want to fill that out, we'll have some fun with that. So, Will, let's go with you on the first one. Biomedical devices present the greatest risk or challenges in a health system for security professionals.
I'd say over the top.
Okay. What do you think of as a greater challenge, or why isn't it the greatest challenge?
I think the bigger challenge is the people who are using those devices and endpoints.
Mm-hmm. Right. If it wasn't for the people, right? That kind of thing.
Yeah, securing the people, I think, is a bigger challenge, actually.
Okay.
Like the technician that might be using your MRI and surfing the internet at the same time. I don't think the device in and of itself is the biggest threat. I think all of the things around the people using those networks and systems and probably create more risk.
Okay, very good. Next point, biomedical device manufacturers have not done a good enough job helping customers secure and patch their older devices. Mayuresh?
It is true to a degree. No,
you got to pick. Sure. You got to pick. Yeah. Agree or over the top?
I do agree with this.
Okay.
Manufacturers should have done a better job of patching these devices, certainly. One of the challenges that Will had mentioned earlier is even if the patches are provided, it's really to go and update each and every device on the network. So while that is happening, we also have to think about how those patches are going to be deployed across thousands of assets that an organization might own.
Right. Yep. Very good. All right. Theresa, the last one's for you. Politics and turf issues around who owns the responsibility for biomedical devices make securing them harder.
I'm probably going to be unpopular, but I'm going to say over the top. I think we've improved and we've matured over the last several years. If you'd have asked me this question, even 3 years ago, I probably would have agreed with that. But I think we've done a good job of educating clinicians and, IT personnel and others about how important it is to secure them. So I don't think they're making it harder for us. I think it just is a hard thing to try to tackle in general. So I would say this one's over the top.
All right, so we're closing up the poll here, and we'll take a look at the results. So for the first question or statement, biomedical devices present the greatest challenge in a health system for security professionals. Only 37% agree with that statement, while 63% think it's over the top. Biomedical device manufacturers have not done a good enough job. I hope they're listening. 81% agree with that statement, and only 15% think it's over the top. And regarding politics and turf issues cause a problem around this issue and help cause the problem, 52% agree with that statement, and 44% think it is over the top. So we're going to share those results, and you can take a look at those. And now we're going to go with our Ask a CoPanelist feature. So, Mayuresh, do you have a question for either or both of your CoPanelists?
Certainly. Wanted to understand from your perspective, if medical devices are not the biggest risk you see in the environment, what are the priorities, from your perspective, that you typically put a majority of your focus in the next year or two?
Will, you want to start?
I already kind of gave away the answer on mine earlier, and that is I would say securing the people. Probably spend most of our time, everything from social engineering threats to email vectors and all of the high volume stuff that we deal with. You can do a really good job of securing a medical device only to have the person using it do something that creates a bad day for you. So I think the human element to our security is such a big component. We operate, all of us, in very complex healthcare systems with lots of people, lots of visitors, lots of people in our facilities and so forth. And that training and education around the people and all of the technologies necessary to help fill in the gap. The email vector is a huge vector. All of the other social engineering ones that are picking up, we've done a really good job of training people about email and clicking on links, but the bad actors are at them from many different vectors, not just email. So I would say that one.
Oh, sorry. Go ahead, Will. Go ahead, Will.
I was just saying that's where we're spending a significant amount of our time, I'll say.
Very good. Theresa?
Yeah, I think what I would add is, the first step to recovery is realizing you have a problem. And so I do think it's important to assess your environment, because then you can use that data to then start educating the people, because I agree with Will, people are probably your biggest, choke point or where you could have issues. But without appropriate data or understanding what your issue is, it's really hard to educate. And I think that's been the challenge around biomedical devices, is most people don't have the data about what their environment looks like. And so first find out, do you have a problem, which most people do, and then, start socializing that problem and educating people on it, I think is really the next step to, moving towards recovery of, in the areas that you need help with.
Okay, I want to get a couple of audience questions. What have you done to be proactive with legacy devices which run legacy operating systems which are not upgradable? As an anecdote, we had a white hat team evaluate our organization and used credit card readers in our cafeteria as an exploit. Will?
I think we talked about a number of them. It's defining the risk profile of those devices and designing a security architecture around them to reduce those threats. So everything from a lot of the things we mentioned, deception technologies, anomaly detection, segmentation, all of those things that we talked about to wrap around those. When you can't upgrade them, you have to mitigate it some other way. And that really starts with a risk analysis and really understanding and doing the threat mapping of what are the threats to those devices. And once you understand that, then you can design and architect a security solution around it.
Theresa?
Yeah, I would add definitely knowing what legacy devices you have is really step one, because part of the problem is we have thousands of devices. So knowing what legacy devices you have and then sort of, prioritizing those based on where the most risk would be, and then looking at what your options are, because sometimes your only option is to purchase new devices. Sometimes you can segment them. And so it's really putting that design together based on, okay, I know what I have. What can I do? What can I do, and what do I have the resources to do? Because you can't boil the ocean and you can't fix everything at once. So it's really about finding them, prioritizing them, and then putting the right strategy depending on the device.
All right, next audience question. Can Will and Theresa provide some examples of their network segments in use at their facilities? Theresa?
Wow. Okay, this might be outside my pay grade. I'm probably not the best, but so we actually a great example is we segment devices that we know do not have appropriate security. So when I was talking earlier about our gate lab, we have our gate lab on a very specific segment so that it is not talking to anything on the network but the devices that it needs to talk to be able to run the procedure for the child that's going through that particular test that they're having. Whereas, we might take our IV pumps because they have to connect to the EMR, and we've got them segmented in a different way. And we could certainly share, if people wanted to reach out afterwards. I'll get the smarter people on the phone about the technical detail. But, I think it's just looking at the device and then determining the best way to segment it.
Okay, very good. Will?
I'd say the way to approach it is to segment those devices based on their risk profile. Start with devices. Once we've mentioned several times, you got to know what you have. So having the right inventory and then classifying those devices. You got to know which ones of those devices are unencrypted, which ones of those devices don't hold a lot of PHI, which ones of those devices, if they malfunction, could cause harm to a patient. Those are the ones you start segmenting first. As you find what are those device categories, what are those, segment those, and that's the place to start. A lot of people ask, well, where do you start? I have so many kinds of devices. Start with the ones that could cause harm or create you the biggest financial risks, et cetera, and start there, creating networks. So things that are critical to the patient, or things that are touching the patient that could cause harm, like at pumps or your patient monitoring systems and any other kind of device that might touch the patient, and if it malfunctioned, it might cause harm. Start there, start segmenting things, and then keep working throughout the network to properly profile things. But understanding that risk and doing it in a risk-prioritized manner is the way to start.
All right, we're almost finished here. Mayuresh, any final thoughts, advice to our folks on the line today on dealing with this problem?
So the segmentation problem was pretty rightfully brought up here. We have processed data, a large amount of healthcare institutions, and the trends are very obvious right now. Last year, we were seeing average number of medical device VLANs were about 15 to 20. And this year, 2019 data really suggests that they have grown past 30. So every organization is actually investing in building out the right microsegmentation strategy to essentially segment out the highest risk devices. And those happen to be your imaging systems. So step one towards securing is figure out what are oftentimes using off-the-shelf operating systems and try to segment those devices before anything else.
All right, very good. That's about all we had time for today. Great, robust discussion on a very important and challenging topic. So, regarding continuing education, this event, which was produced in collaboration with CHIME, gets you one CEU towards the CHIME CHCIO, that's tough to say, program. So if you have that credential and you've asked us to let CHIME know you were here, we certainly will. Otherwise, let them know. You'll receive an email when the on-demand recording of this event has been posted, and you can take advantage of that. To sponsor one of our upcoming events or book a custom event, you can visit our website or contact Nancy Wilcox from our team, and you can go to our website to view our upcoming list of events, which is quite robust. So with that, I want to thank our featured speakers, Will Long, Theresa, Meadows, and Mayuresh, Ektare, and I want to thank Zingbox very much for making this event possible, and of course I want to thank you, our attendees, for always joining. And with that, everybody have a wonderful day. Thank you.